Silence becomes a luxury we don't even remember until it's gone. But just go to bed one night and hear that persistent ringing or buzzing inside your head, as if someone has turned on an old Soviet radio station, and those quiet nights become an ordeal. Many of my patients have said, "Doctor, everything would be fine, but this noise seems to take a part of me. It's hard to think, my mood plummets as if something is constantly bothering me inside, and I understand this feeling well. It's exhausting, debilitating, and makes you feel older than you actually are." And here's the important thing. Most people are convinced that tinnitus is something inevitable that comes with age and stays forever. But that's not true. Very often, the problem is much more mundane and can't be solved with pills, inexpensive supplements, and certainly not with those useless eardrops that are so widely advertised. And there's one old, almost forgotten Soviet method, which I'll tell you about later. It works surprisingly effectively at night, when the ear is resting and its natural healing processes begin to deepen. But for it to truly work, it's first important to understand what exactly is happening inside our body when noise becomes a constant companion. Interestingly, people over 50 experience this condition more often than others, although they don't always connect it to real causes. Age isn't the enemy here. It's simply a measure of years lived, emotions, and experience. But over time, our tissues lose flexibility, blood vessels become more capricious, and the small structures of the ear react to stress more strongly, and then what previously went unnoticed begins to resonate inside. Like a thin string stretched too tightly, sometimes the noise appears after a hard day, sometimes after a cold, sometimes after a surge in blood pressure, and sometimes just like that, for no apparent reason. And that's much more frightening. But surprisingly, many of those who come to me recall, "I once had something similar in my youth, but it went away on its own, and it wasn't a coincidence. My body was more flexible then, recovered faster, and responded more accurately. Now the reaction has become slower and the consequences are more pronounced, but this is not a death sentence. Rather, on the contrary, it's a signal that it's time to give yourself a little attention and remember what was once the norm: warmth, peace, caring for the little things that affect our well-being more than it seems." There's one point I want you to especially hear. Tinnitus is not a disease per se, it's a symptom, like a light on the dashboard of a car. It comes on not to scare you but to tell you that help is needed somewhere inside, and the smartest thing is not to put out the light with your finger. And sometimes we try to make it worse with pills. That's exactly it. Eliminate what's causing the signal. The mechanism of noise is multi-layered: blood vessels, nerve endings, inflammation, muscle tone, blood flow. In the neck, the condition of the inner ear. Everything is connected, therefore the approach must be calm, deep, and consistent. I often suggest my patients a simple experiment. Before falling asleep, they put their hand to their ear for a minute and listen, not to the noise but to themselves, not to get scared but to understand where the tension is, in the head, in the neck, in the ear canal itself, and every time the person is amazed at how much the body can suggest direction if given a chance. This is very helpful because noise always has its own character. For some it pulsates, for others it hisses, for others it hums, and this character helps determine which recovery path is best. But the most important thing is what I'll tell you about at the end of the video. There is one small, almost everyday object that, if you putting it in your ear at night, works better than most modern noise-reducing medications. This method is old, Soviet, from a time when medicine was strict, honest, and surprisingly practical. It is rarely used today, simply because thinking about simple solutions is unfashionable and in vain. Experience shows that these methods help where medications fail. And before we get to that, I want to say something you rarely hear in the hospital. Tinnitus shouldn't rob you of your sleep, your mood, your love of life. And if you're here today, it means you want to regain that feeling of inner silence, so valuable after 50, a silence in which thoughts become clearer and mornings become easier. It's important to me that you listen to the end, because the chain of steps I'm describing only works in its entirety. Each element complements the previous one, like bricks in a house's foundation. Individually, they mean nothing, but together they provide strength and calm. And when we break down the first key step, you'll feel how everything begins to come together into a clear picture, because we'll gradually dig deeper into what triggers this noise, what sustains it, and how to gently turn it off over the course of several days or weeks. And it's against this backdrop that the very same Soviet night method becomes especially clear. It's as if it turns on an internal restoration, a reaction that the body has long wanted to initiate. and this is where the first important element logically begins, without which no nighttime methods will work, because noise is always about one hidden detail, one that people usually don't even realize, but it changes everything. When you begin to understand the causes of tinnitus, the first thing that strikes you is the amazing connection between how a person lives during the day and what's going on in their head at night, and the older a person gets, the more the body begins to react to things it previously ignored, and here one key detail plays a role. Which I already hinted at: tension, but not the kind we're talking about in the context of fatigue, but deep internal tension in the tissues around the ear and neck. It acts quietly, unnoticed, but it becomes the very string that begins to vibrate and create internal noise. Many people, when they hear the word tension, imagine stress, nervousness, or mental strain. But no, I mean muscle. Microspasms that develop over years. They don't hurt, don't interfere with movement, and don't attract attention, but they compress blood vessels, disrupt blood flow to the small ear that doesn't receive enough nourishment, can't work cleanly and quietly. You'd be surprised, but most of the patients over 50 whom I see don't even realize that they have chronic tension in the suboccipital region, a small area between the top of the neck and the base of the skull. This area contains blood vessels, nerves, muscles, everything that directly affects the functioning of the hearing system. And when I ask someone to simply place their palm on the back of their head just below ear level, almost everyone says, "Doctor, it feels kind of hard, it's as if something is wooden there." This is that very imperceptible spasm. But what's especially important is that this spasm doesn't develop in a day or a month. It's the result of habits: tilting your head toward the phone, working at a desk for long periods of time, lack of sleep, prolonged stress, old injuries, even just the habit of hunching your shoulders in the cold. In adulthood, the body no longer compensates for such trivial things as it used to, and gradually that same internal background noise develops, which at night turns into noise. To help people feel the difference, I give a very simple, almost funny, at first glance, exercise, or rather action. It takes less than a minute, but if you do it daily for at least a week, many notice that the noise becomes quieter. The idea is simple: before bed, when you have already lain down and closed your eyes for a minute, slowly move your palm from the back of your head down your neck, as if rubbing away the accumulated burden of the day. Slowly, without force. Not a massage, not pressure, but a gentle warming movement. With each movement, the muscles relax slightly, the blood vessels dilate, and the ear begins to receive the blood it has been lacking all day. This isn't magic, it's physiology. Muscles that are under constant slight tension perceive warmth and gentle movement as a signal to relax, and the relaxed muscle stops compressing the blood vessel, and the blood vessel, no longer compressed, begins to deliver oxygen to where it has long been needed. The chain is simple, but it works remarkably reliably. A patient once told me, "Doctor, I've always thought the noise was in my ear, but it turns out it's in my neck," and in a sense he was absolutely right, but what's important here isn't the movement itself, but what lies behind it. This small effort, like a door we open before moving to deeper methods, because tinnitus never occurs in a completely relaxed, well-rested person, and that very Soviet method, which I'll tell you about in the final part, works many times more powerfully when the neck stops being a tight fortress and begins to flow blood freely. I'm often asked why the ear is so sensitive to changes in the neck. It's simple. The inner ear is fed by a small thin artery that comes from the cervical spine. It's the only one, with no alternate routes. If it's slightly compressed, the ear reacts immediately. That's why I always explain. It's necessary not only to act on, it's important not only to improve the ear, but also to create conditions that will allow it to function properly. And here it's not massage or inexpensive treatments that are important, but simple, warm, quiet care for this area that we all underestimate. The effect is especially noticeable in those who have long struggled with insomnia. They often complain, "Doctor, I'm going to bed," and then instead of silence, there's ringing. This happens because when a person lies down, the muscles of the neck and head seem to lose control, begin to compensate for fatigue, and the noise becomes louder. And here gentle relaxation before sleep is precisely the bridge that helps transition to nighttime methods and get the most out of them. One 62-year-old woman came to me with a complaint. She had been experiencing a ringing sound in her ear for 3 months, especially at night. Pills didn't help, tests showed nothing. Yes, it remembers old tensions, perhaps lingering for years, and even when a person believes they are relaxed, the muscles of the neck and face can hold their ground, preventing the blood vessels from functioning evenly. And here a simple yet incredibly effective exercise that takes less than 3 seconds helps. Open your mouth slightly, just let your jaw drop a couple of millimeters. This immediately relieves tension in the temporal muscles and even partially reduces the pressure in the temporomandibular joint. Many patients are surprised, "Doctor, why did I feel better when I just opened my mouth a little?" But the physiology is simple. The nerve branch that influences the inner ear stops being irritated, the blood vessels dilate, and the noise subsides. When a person first feels this effect, they begin to understand. The problem isn't in the ear. The problem is not in how the body distributes tension, heat, blood, oxygen, and straighten her position. The noise became quieter. Then I asked her to open her mouth slightly and the whine almost disappeared. She looked at me as if she saw a magician, but this was no trick. The body had simply received normal operating conditions. Stories like these demonstrate that the ear never works on its own. It is part of a system, and improving its condition always requires gentle, calm restoration of all connected structures. Now imagine that in such a relaxed, balanced state, a person goes to bed. The neck is soft, the jaw is calm, the blood vessels are regular, the breathing is warm and deep. It's precisely at this point that the night method is most effective. What you place in your ear at night begins to work not only on its own, but also because the body is finally ready to recover. This is precisely why many who try it without preparation experience only a slight temporary effect, while those who do everything gradually achieve lasting results. But before we move on to the method itself, there's one more important detail, a detail that is almost always overlooked, but which ensures long-term improvement. This is the hidden source of inflammation, silent, chronic, barely noticeable. It doesn't cause pain, fever, or discomfort, but it irritates the inner ear, disrupts the nerve tissue, and makes the noise many times louder. This needs to be understood for the night method to truly help. And once you learn what exactly drives this hidden inflammation, the picture of tinnitus will finally become truly clear. When it comes to hidden inflammation, most people imagine something vivid: pain, heat, redness, pronounced symptoms. But the real problem, which worsens tinnitus after 50, is different. It works quietly, almost imperceptibly, like a thin layer of rust that remains hidden for a long time under a layer of paint. And it is this silent rust that irritates the inner ear, causing it to function erratically and the brain to interpret signals incorrectly. This condition unnoticeably drags on for months, years. And a person gets used to it, thinking it's just age. But it's not age, it's a localized microinflammatory reaction that few people realize they have. What causes it? Most often, trivial everyday things: dry air in the apartment, a lingering runny nose, an old otitis that once passed but left a weak spot, even the habit of washing your hair with hot water and immediately going out into the cool hallway. All these little things create conditions in which the tissues of the middle and inner ear are pushed to the limit. They're not inflamed in the usual sense but irritated, and irritation is the main source of internal noise. One 67-year-old man came to me complaining of a ringing sound that had plagued him for 2 years. Examinations showed his ear was fine, his blood pressure was stable, and his blood vessels were normal for his age. But when I asked him a simple question, he was surprised. "Do you use the air conditioner often?" He replied, "Yes, all the time. The air is dry, otherwise it's hard to breathe, and that's the reason." Too dry air chills the mucous membranes of the nose and the eustachian tube, the very tube that connects the nasopharynx and the ear. When it's not working properly, the ear loses its ability to equalize pressure, ventilation is impaired, and that same internal whining appears after 2 weeks of humidifying the air. The noise decreased by 40%, but sometimes the source of microinflammation is even more subtle. For example, hypertension, even mild, causes constant tension in the small vessels of the inner ear. They become less elastic, conduct blood less effectively, and the cells, starved of nutrients, respond by producing a false signal which the brain perceives as noise. And if a person never monitors small pressure surges,